While we're waiting to begin, I invite folks to share, introduce themselves in the chat, share where you're dialing in from today. Nice to see a bunch of community living folks online. Yes, we will be sharing a recording with participants. Hello, hello. It's nice to see so many different regions represented. Just wait a couple more minutes for folks to trickle in.
Pam, I think you can get going.
Okay, perfect. Good afternoon, everyone, and thank you for joining our webinar on the nonprofit HR crisis, how to create wage parity in community care. My name is Pamela Upal, and I'm the Director of Policy at ONN. So if you're new to ONN, welcome. We're the provincial network for Ontario's 58,000 nonprofits and charities, focus on policy, advocacy, and services to strengthen Ontario's nonprofit sector as a key pillar of our society and economy. If you're already a member of ONN, welcome back, and thank you for your support. Our public policy research and advocacy work would not be possible without you. A couple of housekeeping tips. If you experience any tech difficulties during the webinar, such as a visual lag or something happening with your sound, we recommend closing your web browser and reopening and joining the webinar again. If you still experience any problems, you can type the issue into the chat box and our team will try to respond as soon as possible. I encourage you all to ask questions, share comments and insights as we go through the presentation today in the chat box. Our team is monitoring it. You're also welcome to sharing comments and learnings on social media as well. To answer our most common question, you will receive an email with the recording and resources in about a week. To ground our webinar today, I want to begin with acknowledging that we are meeting on unceded and unsurrendered land that has been inhabited by Indigenous people from time immemorial. The ONN office is located on the traditional territory of the Wendat, the Haudenosaunee, and Mississaugas of the Credit. This territory is part of the Dish with One Spoon Treaty and is also covered by the Upper Canada Treaties. At ONN, we believe that as nonprofits, we must take seriously our role in responding to the Truth and Reconciliation Commission's 94 calls to action. For ONN, this means embedding into our policy files and advocacy concrete ways to move forward the calls to action and promote the self-determination and well-being of First Nation, Inuit, and Métis communities. And as I reflect on, we're talking about wage parity today, we're talking about labor. It makes me think about the extraction of the extractive nature of colonialism, the way in which it pulled communities apart, devalued work that was done, and really sort of reflecting on what that reconciliation lens means to the wage parity work we're trying to do and for whom. Next slide, please. So today I really want to paint a picture of wage disparity in the nonprofit sector for all of you. I'll be walking us through the paper that we launched a couple of weeks ago. I also want to take some time to share tips on how to use the paper as an advocacy tool, so sort of differentiating the policy recommendations from the advocacy call to action. And we actually do have an advocacy toolkit for the paper, which we'll share after the webinar today. And then I'm going to invite Susan Bender from Toronto Drop-In Network to share some reflections on how she's been working within the sector to mobilize for wage parity. And then we'll open up the floor for conversation through the chat, and there's a Q&A box as well, so you can send in your questions and answers there, and then we can address them. Next slide, please. So before I sort of get into the paper, I really wanted to take a moment to define what we meant by wage disparity. Wage disparity is not a term that we coined or anything like that. It's common, language that folks use, and it has different meanings in various contexts. But the context in which it kept coming up for us in our sector and in our network, and which I'll talk about was the impetus for writing this paper, was the wage disparity for workers in government-funded services delivered by the public sector, for-profits, or nonprofits. So what we're talking about is the fact that staff with the same job, responsibility, and qualifications receive vastly different wages in the various sectors, even when they're all funded by the same government program. And within those, often nonprofit wages are the lowest. And to add to that, the playing field, so this field of where government-funded programs and services operate, usually there's an unequal playing field for nonprofits. So I'm thinking about Bill 124, the wage restraint legislation that restricts how much wages can be raised by nonprofits who are a transfer payment agreement agency, while at the same time for-profits are exempt from that legislation as well. So again, there's a lot of conversation around wage disparity, and it means a lot of different things. But for the purpose of this paper and the scope of this paper and the work that we've been doing, this is what we mean by wage disparity. So same job, same funder across 3 different sectors, but vastly low wages in our sector and unequal playing field that's not in favor for nonprofits. So how did we sort of come to write this paper? Our network was really ringing the alarm that staff were leaving the sector and care services in droves. And we started hearing about this, quite honestly, last October, November, when there was a lot of conversation happening about the Great Resignation and labor force shortages. At that point, we didn't have Canadian data to point to that happening in Canada and Ontario, but we knew it was happening in the States, and we could sort of see it sort of trickle down and play out in our sector as well. So a lot of folks in our network across the province reaching out, hey, people are leaving. Hey, there's a big high job vacancy rate. We can't recruit staff. We can't retain staff. We just can't compete, with something that we heard over and over again. And so the purpose for us was to really understand, what is wage disparity? So the defining piece that I just did. What do we mean by that? What does it look like? What's the extent of it across our sector? At that point, we're like, is it only happening in certain subsectors? Is it just a social service issue? Is it just, issue with childcare, et cetera, or is it broader than that? Why is it happening? We knew there was something different about this moment, right? Wage disparity has always existed, but why was it a big deal in this moment? And then try to surface some common solutions for change. And that's sort of how we set out. sort of being like, okay, this is what we want to accomplish. We really had to scope the paper as well. So it is very narrow in that sense. We're really focusing on frontline gendered and racialized jobs that have been the most impacted by the pandemic. So here I'm thinking about PSWs, DSWs, childcare workers, shelter workers. A lot of these positions, they weren't shut down, they were operating beyond capacity, meeting service demand, but wages, working conditions had not kept up. And they were also on the front lines of the pandemic as well, greatest danger to being infected. The other scoping piece around this was that there had to be an equivalent job for us to compare to in other sectors. And that goes back to what we mean by wage disparity. We really wanted to explore that phenomena when it's the same job across 3 sectors, but the nonprofit sector is being, the job in our sector is being paid less. And so we set out in doing in-depth interviews with 7 different provincial associations. So we really wanted to hear from what was happening on the ground, but knew we couldn't talk to everybody because we wanted to get writing on this paper, make sure we get it out and sort of align it with election, new government, and government relations work in that sense. So we sort of picked 7 associations, big associations that had broad members and networks on the ground to tell us what they were hearing, what they were seeing, what they thought the root causes were, why this moment was different from them, what solutions were coming up, what were they already working on, what do they wish they were working on, and what do they wish they could tell different stakeholders. And by stakeholders, I mean, communities, municipalities, the province, the feds, the general public, what were some messages that they wanted to get out. And I just want to take a moment to thank all those, different associations who took time to chat with us. It really brought the nuance and the stories from the ground into the paper that would not have been possible without their conversation. So thank you. And Susan was one of them, who we'll hear from in a bit. The audience piece was really important as well. And it was something that we thought about as the project and as the paper writing and the key informant in conversations progressed. On the one hand, we really wanted to write for government. And so you'll sort of see that element in the paper, the way in which we're connecting wage disparity to hurting Ontarians, how community crisis impacts communities across Ontario, how we're wasting money, all of those language pieces were intentional, and that focus on communities and families and individuals was intentional. But at the same time, we also wanted to write with the nonprofit sector in mind, really wanted to document what we meant by wage disparity and the phenomenon that everybody was talking about, and sort of have people look up instead of looking down at their subsector, but look up and see it's happening everywhere else. And then we also wanted to, influence the general public too. And so you'll see some of those language pieces reflected in the paper writing. Next slide, please. And so just wanted to take a moment there and ask folks if we missed anything, or if you think something was missing from that scoping, that methodology, please feel free to drop it into the chat. Happy to hear feedback around it. The one thing I didn't mention was timing. If we had all the time in the world, we definitely would have wanted to talk to more folks, include more. This was essentially almost a 20-page paper, but we really wanted to make it short, concise, and move quick on it, because we knew there was, going to be an election, and that there was going to be a new government or a refresh mandate in place, and there was going to be some GR activity happening after that. And we wanted this to be a tool for that time. Next slide. I just wanted to spend a couple of minutes talking about what the paper doesn't have, where the limitations of this work is, and where we really wish we could have dug more deep if we had more time, and the turnaround wasn't as quick as we had planned for it to be. But I note that, we've heard of wage disparity being an issue, not just in the social services that we've highlighted in the paper, but also in sports, also in arts, in community health centers, and that it just might be manifesting in different ways. We didn't have an opportunity to talk to folks from those different sectors, which is why they might not be reflected in the paper, but know that we do have that in mind. And part of the conversation today is also to bring that perspective to the forefront. We also know that, something similar is happening in Black-led, Black-serving, Black-focused nonprofits or Indigenous benefiting, Indigenous informed, and Indigenous-led nonprofits, where their staff, might be leaving or are leaving to do the same work, the same job within their communities to work for the public sector. And so again, didn't have an opportunity to explore this, but wanted to recognize that this is somewhere more work can be done as well. We also, wonder what's happening in other positions, like the executive director role. We know there's, a lot of resignation happening on that front, and also a lot of retirements and other functions, right? It's not just about the front line, although that was the most impacted, where we saw the most opportunity, but also, there's been a difficult time recruiting finance and HR and other positions of that way as well. Also thinking about, what is the difference between urban and rural settings. And at the end of the day, each subsector has their own data set and their own numbers and their own, this is how much wages are. But we don't have a broad sector-wide, province-wide data set around this is what everyone makes and this is what everyone makes in relation to others. We know broadly what the average Canadian income is and what the nonprofit sector average income is, and there definitely is a big gap there. But definitely there's more scope to do some work around the numbers. So just wanted to highlight those limitations, and that it's something that we're thinking about and would love to hear what others have to say. And that's another question I have for folks. Can you share any stories or examples in areas the paper is limited to bring nuance and shed light in places that we might have missed? Again, feel free to drop that in the chat as well. So the policy recommendations that we came up with, we wanted it to be twofold. One, we definitely wanted some language and recommendations around what the province can do, because ultimately that's what it is, right? The transfer payment agreements are with the province, they're funding these services, we need them to up their game. But we didn't want to solely focus just on investment. We were really thinking about, if we do have a government that does not want to invest at that time, what could be other solutions and what could be other wins? And then we wanted to have some things for what the sector can do. We might not always have an opportunity or a policy window or an advocacy window with the government, but that doesn't mean that we should not be working on the issue. And a lot of the folks that I talked to had some really great examples of what they were trying to do, despite what the policy environment might be, what they were trying to do within the sector to mobilize against wage disparity, to mobilize for wage parity. And so some of the things I wanted to quickly highlight here were, definitely asking for targeted money. Again, you'll see that the language and the recommendations are targeted towards the government of the day, where there's, annual installments, make this something that happens over a period of time, phase it in. That was intentional. There's an element of redesigning funding agreements as well. And this was really to speak to the wage compression that happens, because on the one hand, we were getting pandemic pay for PSWs and DSWs. But what I also heard from the sector was that was causing wage compression between the organizations, which is why there is an element of, if we can redesign funding agreements with that equal pay for equal work value principle, so the global budget increases, that we can sort of avoid some of that wage compression piece as well. Labor force strategy is where we see the most opportunity, to be quite honest. There's a huge emphasis on getting people back to work, to jumpstarting the economy, for employment. And so if we can pitch, help us build a workforce development plan, a labor force strategy to combat some of this work, there might be some opportunity in getting that done. And then expanding nonprofit services, right? Another way to get more investment into the sector and to create decent work jobs. For nonprofits, we really just wanted to stress, convene. I heard so many folks talking about how they get together, they talk to peers, they talk to their networks about what funding proposals are putting in, how much they're asking for. And that has power, right? If you can align on those pieces. I know there's groups out in Ottawa, there's groups in Toronto that are doing some of that work. That goes a long way. To ask for a labor force strategy, which we'll talk about in a little bit as well. But something new, I think, for perhaps, I know for ONN, putting forward a recommendation is really thinking about how to collaborate outside of the sector. So unions, individuals, families, the general public, how can we build allyship with them to have more people saying the same thing, but not necessarily the usual suspects. And then now I just wanted to spend a bit of time talking about the paper as an advocacy tool. So there's clearly there's policy recommendations in the paper that we hope you can push forward. But there was a bit of a different element that we wanted to do around advocacy. So those policy recommendations, you can embed and push forward, but how to really use the paper to do advocacy is sort of a different set of call to actions. So we've created a toolkit, which we'll share after the webinar, where we have messages for the 3 different audiences, tailored key messages for the 3 different audiences, because all 3 different audiences have different motivations. So one set of messages and call to actions are for your sector and your network, how to talk to your peers, how to talk to your networks about wage disparity, what messages can you get across, and what can they do. The second audience is the Ontario government, how to push for some of those policy recommendations we've put forward. And then the third one is families and the public, right? At the end of the day, the public and families are the ones that are considered voters and constituents and voting in government whose we're contracted with, right? So how can we sort of influence them? How can we work with them to highlight the connection between high quality of care and nonprofit driven services? So some of the big strategies or the ways in which you can use this paper as a tool is, use those messages and talk to your peers and networks and really think about how you can work together to raise the boat for everybody versus doing your own funding proposals or your own sort of advocacy and GR work with your line ministry or your program officer at a ministry. But how can you share information and share intel and sort of come up with strategies together, whether those are subsector based, region based, local based, program based, job based. There's so many different ways to make those connections. We're also very much so stressing, meet with your MPPs and MPs. The local is very important to government. The local MPPs and MPs care about their communities, care about their constituents. So take the paper, schedule a meeting and be like, hey, there's this paper. We've been talking about wage disparity. This is what the phenomenon looks like. And share a story from your community and how it's playing out. Because of, wage disparity, we're short staffed, so we have to close down some services, which means people in our community can't access XYZ. Sharing simple examples like that of what's happening in their community makes that connection from the broad, big picture wage disparity piece to how it's really impacting folks on the ground. Of course, always, you can embed your policy recommendations in existing advocacy work. If you're already meeting with the MPPs, you're writing cabinet letters, welcome letters, meeting with cabinet ministers or even bureaucrats, if there's any element in there that aligns with what you're doing, please feel free to embed that as well. And then again, stressing, really thinking about how can we organize with our communities that we serve, the clients that we serve, how can we, at the very least for them, make the connection between wage disparity and the quality of care. We know that's been quite apparent when it comes to long-term care, but it might not be so based on in different subsectors, right? Folks might not know the difference between a nonprofit provider and a for-profit provider and what they bring to the table and how it can compromise quality of care, and just doing that awareness building with our communities, giving them that language to talk about quality of care and nonprofit, versus for-profit, et cetera, can be quite helpful as well. And so another question for people to answer or share some insights and thoughts on any challenges you foresee in using the paper as an advocacy tool. And I'll just pause there because I think there was some stuff in the chat. So we had a comment around, can we use COVID recovery as a leverage to revitalize and addressing wage disparity and required staffing shortages? The sense that I've gotten is, COVID, folks don't want to talk about COVID anymore, or even COVID recovery. And so we've intentionally stayed away from using that language as well in the paper. I think I only used it once to say COVID endemic. That's not to say that we don't think that the pandemic is still ongoing, et cetera. It's more, again, being intentional around language we're using for the audience. And so I don't know if that would have as much impact as other language or messages we've put together in the toolkit. And then some other pieces in the chat too. And thank you, Kathy, for sharing that. Another link that I wanted to share is that we want to start building coalition around wage parity and wage disparity. At the very least, a list of folks who are interested in doing this work together. So I'm going to pop a form in the chat. It's a simple Google form, really just asking for your name, organization, and contact information. And so we can generate a list of people who are interested in working together on some coordinated efforts on this issue. And so if you're interested, please fill out the form, and then we'll get in touch as there's opportunities to align on messaging. I think I was only able to send it to the host and panelists. So if the other hosts and panelists can share it in the chat, that would be great. Okay. And then just wanted to quickly just go over some of the findings that we had. So we had about eight findings, or 8 sort of reasons for why wage disparity is an issue. And the piece that I wanted to highlight with the first one is around the bulk of the paper really talks about, nonprofits aren't necessarily competing with for-profits, which was a surprise for us. We kind of didn't know what we were going into, what we were going to hear, but had a bit of a sense, and really thought that for-profits would be more part of the conversation around wage disparity, but it really was us competing with municipalities, hospitals, and school boards, where the pay disparity is up to about 30%. And so again, here it's not, we don't want to lower the bar of municipalities, hospitals, and school boards, but really are asking for the nonprofits to be lifted, to be on par with them, and really highlighting that they're offering such great jobs because they have the funding and money to do so, and we should have the same opportunity as well. Where I think, there could be some more room to explore that we didn't in this paper was maybe we're not competing with like for-profit childcare, for-profit long-term care in the same sense, but other for-profit companies that can offer signing bonuses or are offering signing bonuses in completely different industries that would make it harder for us to recruit folks into our sector. The second finding around just devaluation of care work, I don't think is surprising for anyone. The undervaluing of nonprofit care work is very much so linked to the low value of funding, low value of wages, and to make that connection explicit is really critical. And it's not just about who's doing the work, but it's who this work is serving, and the sort of charitable model that our sector is set into, or not set into, but is boxed into, that is not reality anymore. And so that charity mindset being like, well, you're doing great work, so you don't have to be paid accordingly, can set the sector back. And that's definitely rooted in, racism, our notions of sexism, classism, and colonialism. We heard loud and clear that the working conditions or the low wages, that workers could just not survive on those. And that's why they were leaving, to be quite honest. And that why this moment was different is because of skyrocketing inflation, right? It's accelerating the exodus of workers. The rising cost of fuel and groceries and housing meant that workers were making difficult choices. And so, we had folks talk to us about, it was difficult to see some of their own workers accessing services that they provided themselves, or that the sector was providing when it came to food and housing insecurity. The fourth one was around government's patchwork. And this was really interesting because this is what comes out when you talk to a variety of people in the sector who have been doing this work for ages and ages and have so much expertise and knowledge. But, again, wage disparity is not a new problem. It's always existed. And there's been this patchwork of like legislation here and, funding pot here over the past 2 decades to deal with it. But it's been patchwork and hasn't really gone deep and addressed the systemic undervaluing of nonprofit care work that continues to drive wage disparity. Something new that we learned this time around, again, we sort of knew, but documenting, was a reliance on temporary staffing agencies. Network was telling us about this I think from October onwards, but it was not nice, but it was good to hear from folks and get that down on paper. And just, if you can't recruit and retain folks, Bill 124 is a significant barrier to raising existing wages. You're turning to staffing agencies because there is no rule around that, right? You can pay them as much as you need to get staff in, and then of course staffing agencies take their cut and then bring workers in. I think the surprising piece was that in some cases, workers were still making more with staffing agencies and having more control over their schedules than they would with an organization. So really thinking about that's not a permanent system building solution, staffing agencies, because what high quality care work thrives on relationship building between client and care provider, and that doesn't exist when you have constant overturn and are using staffing agencies. And then number 6 around race in a bottom with artificially low wages was really thinking about that divide and conquer austerity mindset that we have, scarcity of resources we have with funding, which is what drives the low wages, et cetera. So really thinking about how that's being perpetuated on the funder side, but also thinking about, how do we as nonprofits fall into that trap? How do we start perpetuating that cycle by cutting bids and not putting true costs of service in, and the tangible impact of that on our workers. And more of a high level macro piece, the sector has been chronically underfunded for 3 decades since the early 1990s. And that, everyone knows, and I want to acknowledge that there hasn't been an increase in cost of living or billing or base funding. And that, of course, is a challenge as well. And that sort of perpetuates not knowing the true cost of running services. And then the last piece, or the last finding that we had that I wanted to touch on, was the lack of just systemic planning. And there might be plans for particular subsectors for sure, but just looking up and seeing the big picture, how childcare, long-term care, disability services, settlement and refugee and immigrant services, shelter, like how all this social care infrastructure is interconnected and relies on each other and shares pools of people and workers, that there's no systemic approach to that labor force strategy. And what if there was? Right? What would that mean in dealing with emergencies, public health crisis, and backfilling positions? So a lot of conversation around that as well. And so I'm going to pause there and invite our panelist for today, Susan. So Susan Bender is part of the Toronto Drop-In Network. She was a key informant conversation that I had in writing this paper. And I wanted to invite her to just share some reflections on what her work in mobilizing with the sector has been, what she's seen for doing this work, and just share some other reflections and kickstart our discussion conversation. So can we pin Susan to? Hi, Susan. Great, there you are. Okay, so why don't we start? Do you want to share a little bit about what the Toronto Drop-In Network is?
Sure. We are a Toronto-based network of over 50 member organizations, all of whom are nonprofits, that run about 48 drop-ins for people who are homeless, precariously housed, socially isolated, street involved, as well as like allied outreach services and other kind of allied programs. I don't know how familiar people are with what drop-ins, daytime drop-in programming is, but we really, in the first instance, we were a place where you don't actually have to have a reason for showing up. It's a sanctuary space where people can come inside and just be in a welcoming and dignified environment, and then can access basic needs like laundry, meal, showers, but also have opportunities to be involved and kind of develop some or recover a sense of self-worth and identity, maybe get some referrals, support to access other services that might be helpful for folks. And of course, drop-ins are as diverse as the communities that they work with. So we have drop-ins in larger multi-service organizations. We have standalone faith-based drop-ins serving, some focus on youth, some on women, some on the two-spirited LGBTQ community. And of course, the folks who are coming to drop-ins reflect the kind of systemic discrimination in the wider society. So we certainly have a disproportionate number of folks who are Indigenous and who are Black who are coming to drop-ins. So the role of TDIN is to support good practice in these spaces, through training and access to training. We sit at systems tables, planning tables to give a voice to drop-ins. And we also do a lot of advocacy for that support the work of drop-ins as well as the communities that are coming to them. All our members are in Toronto.
Okay, great. And so, I know you guys don't call it the wage parity issue, you call it the human resources crisis. So you want to share a bit about when and why you started working on the HR crisis and the wage parity issue? Or how did you see it pop up in the network?
I mean, true. I've been with the network for over 6 years, and this has been an ongoing conversation amongst our members, difficulty in recruiting and retaining staff. It was happening before COVID. And, this is in the context of a shelter and housing crisis, an overdose and poison drug supply crisis that's causing huge numbers of premature deaths. So there's a lot of grief and loss and frustration in the sector, which I think is just important to situate kind of our conversation. And then COVID happened, and we saw drop-ins remain open, doing frontline work. Some did a lot, just pivoted to doing takeaway meals, virtual services, but really gone as essential critical workers, but with absolutely none of the acknowledgement of that. And we immediately started to see the gaps in staffing as people who couldn't come to work because they were immune compromised or had other health risks, and then having to go into isolation. So immediately we saw the pandemic really affect the capacity of drop-ins to continue to do really, really, really hard work in really difficult circumstances. So there were a couple of things we tried to do immediately with that. Was we tried to pull together a pool of potential candidates, and we're really trying to draw from communities that aren't necessarily recruited from for this work. And so it was a pool that our drop-ins could recruit both staff and volunteers from. We also worked with another homeless service providing network. And we produced a position paper that was describing, drop-in workers, shelter workers, and respite workers as essential workers, and recommending a wage that would stabilize this essential workforce and really begin to kind of start building some equity between the community-based nonprofits, city-funded, and then city-delivered services. And part of that was also to position this shift as part of a fair wage policy within the City of Toronto. It already exists for contracted services, and we're saying, like, we are actually contracted services. Let's build this into a fair wage policy. And we also did reach out to the District Labor Council and some unions. It got stalled for lots of reasons. So that's kind of what was propelling us. I could go through all the impacts for workers, for organizations, for the sector, but I think, the ONN report really surfaces. I mean, there's some nuances, but we know the quality of services, the morale of workers, their financial viability of the work, and the sustainability of the sector has really been impacted by low wages.
Yeah, so that's what I was going to ask. I know during our conversation, you had a sense of what the extent of wage disparity between municipal or public sector positions and those in the same sort of positions in your network. What do you want to share a little bit how big that wage disparity is?
Oh, well, I mean, some of our member organizations, not many, but some are paying minimum wage, and within like city run operated shelters, maybe a starting wage is around $35 an hour. So, that's almost a $20 difference, right?
And I think that was what we were hearing from, childcare, long-term care, disability services, settlement, employment and training, even across the board, and that disparity being quite big. And it's not just the wages, it's also the stability, the pension, the benefits, and all of that come along with it.
Yeah. And I think that's really important for our kind of strategic thinking about this. Is not just wages, because we feel like people come to this work from a commitment to communities. If we could ensure full-time work, if we could ensure professional development opportunities, well, for sure, we have to build in like grief and loss supports. It would make the jobs themselves in the sector more sustainable. So it's kind of a broader purview than just employment, but it all comes down to chronic underfunding and undervaluing of the work.
And one of the other pieces our conversation also highlighted, which you've touched on, is the work is hard, right? You're on the front lines, you're dealing with vicarious trauma, you're dealing with lots of hard things on the job, right? And so it's hard to sort of even think about how do you compensate for that? How do you start to build a compensation package around that, right? So you've talked a bit, you did the pooled resources, human resources piece. What other things have you worked on with your members to sort of mobilize?
So it was interesting to me to see I think it was Ray's chat saying it's been 4 years since any funding agreements have changed. So the City of Toronto put out an open call for all homeless service providers. And for drop-ins, it's the first time in 7 years that there's been an opportunity to put in a funding proposal. And throughout that 7 years, there's been almost no increase, a flatlining of budgets. In a couple of years, they got a 1% increase. So you can just imagine with inflation, the kind of pressure that's put on drop-ins. So this seemed like a real moment to seize and to try to be strategic and collaborative. So we have called together our members on three. So I should also say that it's only about half our membership that are actually receive City of Toronto Shelter Support and Housing funding. So we, as one of our members said, like this is a really rare opportunity to ask for a higher amount of funding and to ask for aspirational budgets, which really is actually, it's aspirational to ask for what you actually need. So we thought, but it's very difficult. And some of the challenges, I mean, we could talk about that later, but part of it is if you don't get the funding, then you're making impossible decisions about cutting services that impact on communities you deeply care about and are connected to and come from, or you're affecting staff in terms of what's available for them in compensation. So we have we kind of put out a call to our members to say this is an opportunity to really circumvent this competitive, potentially divisive model of open funding calls where anybody can apply. Doesn't matter if you're doing the service. We don't actually have enough money for all of you, but anybody can apply. And then that would also address the undervaluing of the work of drop-ins and of workers who, as the report really highlights, are predominantly women, racialized workers, and in our sector in particular, workers with lived experience. They can be called peers. There's lots of names for them, but they're also within this more marginalized workforce. And to try to see if we could start creating some equity between the large and smaller organizations. And then we just really believe that drop-ins, if we come together, we could do more than if we try to negotiate this all separately. So we really wanted to use this as an opportunity to mobilize our collective voice. So we've had 3 member forums, and I have to say, you can almost like probably hear the sigh of relief, because people have been carrying this for at least 7 years and certainly long before that, to be able to come together and say, we're going to try to work on this together rather than, doing our negotiations, and just to be able to talk about, we said, okay, where are you chronically underfunded? What is the impact? Like to actually tell those stories. And then what are the minimum standards that we can work towards to increase equity and sustainability. I need to say also, Toronto Drop-In Network doesn't have a mandate that tells our members what to do. We're there as supports and provide some leadership in these discussions, but this is all agreement based. And in the end, I wouldn't say that I know what all drop-ins have put in for their proposals, but so we looked at wage comparators. We brought forward 4 different wage comparators. One of them was the Ontario Living Wage Network. The other was the entry-level city shelter worker, what they're paid, kind of analogous work from the Association of Community Centers in Toronto. And then we also looked at the pandemic pay top-up. And one of the reasons this is an interesting moment is because when speaking with the municipal funder, like the fact that both the province and the city of Toronto brought in a pandemic pay top up is a recognition of the undervaluing and underpaying of work, and they can't make that go away. Like, they've acknowledged that that's the case. So this is and we do know that because they're also seeing people move to the private sector from the city government. So that was also a comparator. So we agreed this is this is what we want to move with. So nobody put in a proposal with salaries below that.
Nice.
We also talked, offering full-time positions, benefits, like how do we calculate benefits, what kind of professional development funding did we want to ask for, what kind of staff to drop in member participant ratio. So those are all the kinds of things that we try to identify to integrate into kind of a collective response to the funding proposals. We also help to craft some language and rationale that our members could use in their proposals that would support these with significantly increased asks. We also took the lead to communicate with the current, like the funder that we're targeting right now, to let them know in advance, you're going to be seeing these proposals from drop-ins that actually reflect real costs, and you need to know they're coming and not just deny applications outright. We also tried to get a motion through City Council that would apply funding to fill the gap between what was available for drop-ins and what the total requested amount was. We didn't win that. But that was another piece of the strategy. And now we're looking at the proposals are in. Funding decisions are going to come out to drop-ins this week and next week. So looking in two ways. One is, how do we support that negotiation process so that we can stick to our commitments? And the second piece is, what is the broader external advocacy that we need to be doing to support this negotiation process, but also, go after the city to maybe currently in the next budget cycle. And even though we're a Toronto-based network and we're tiny, we also recognize that the province is a real target in this strategy, is particularly the Ministry of Health. So that's what we're trying to do.
Not a small feat by any chance. I guess, before we move into Q&A, so hopefully everybody that's listening in, you can start thinking about questions you want to ask. But Susan, can you speak to maybe like one way in which you've seen the needle moved on the issue with the mobilization work you're doing, in one way that it just isn't working, one thing that you haven't seen shift? So maybe like a good thing and a not so good thing.
I think somebody put something in the chat about, we've operated in a context of scarcity and I'll say a charity model for a long time. So I think that the courage of our drop-in members to come together and kind of start peeling away that and and try to work together and say, no, we're not going to be divided on this issue, I think is a really, because it is a it is a culture shift for all of us as well, that we have to also integrate into the strategy. And then we have like people, senior people, and when I say that, I mean people have so much experience who are right there at the table saying, we will help. This is what we've learned. Here's a good idea and strategy. So just like that, people have such great ideas, and sharing those ideas and actually concretely supporting maybe in the negotiation. If you've never negotiated with a funder, that's kind of an intimidating thing to do when your whole drop-in relies on that funding. So those kind of collaborations have been really positive. One of the challenges in unionized multi-service organization environments, if drop-ins are a small piece of that, if we, get higher salaries within drop-ins, that pushes the scales up, and that has knock-on effects. So to speak to your point, like this really needs to be a broad strategy, and each of us need to be doing our piece, but have an opportunity to be collaborating in a bigger way will be really important for this to be effective. And I do think we have some allies within unions and labor councils. Yeah. Yeah, I'll stop at that.
Yeah, no, those are great examples of what's working and what we need to push a bit more on. So now I'd love to invite, to open up the chat and the Q&A box with any questions folks might have about the paper or work going forward or work that Susan's doing. We're happy to answer those. And then if not any questions, would just love to hear insights on, what resonated, what's missing, and what are you doing around wage parity or would want to do where we can work collectively on. Any of those pieces would be great. So let me just. So there was one.
Do you want?
Question.
Go ahead.
Susan, is the pandemic pay top up the same as a permanent PSW wage enhancement recently implemented or different? And on top of the $3 per hour wage increase? I think it's the same one, but Susan, you might know more.
Yeah, for the city of Toronto, it was only the shelter, support and housing purview that received, and both of them are temporary and they're finished. So they provided a top up mostly in response to Omicron. So it was maybe 6 months, and it was a $4 an hour top up on top of like hourly wage, which was awesome, right? It really made a difference for folks. And then this second one I was referring to was provincial one. That was it was also temporary, and it was a top up, and there was complicated calculations which their spreadsheet did, but it was for anybody who was considered an essential worker. So we actually did do a bit of advocacy, say shelter drop-in workers are essential workers providing life-saving work during the pandemic. But both of those pandemic pay top-ups don't exist anymore.
Yeah. And I think the provincial permanent one is for PSW and DSWs only. Yeah. Another question we have in the chat, how do we compete with for-profit sector in terms of retention if we don't base it primarily on compensation and salary? Any good ideas? Any thoughts, Susan, on that? So how do we compete with the for-profit sector?
Yeah, I think opportunities for professional development, there's trainings, and one thing that we is a big piece of the work that we do is all our membership fees go back to our members in the form of training allocations. So and it's on a sliding scale. So it really supports smaller organizations to send staff and pay for training. And we've heard from the sector, like people would stay if there were other benefits like ability to go to training. We also provide opportunities for our members to co-facilitate some of our training so that they could take their experience and learning and expertise and share it out, kind of develop that skill set. And of course, advanced, and that's, I think, what you were talking about with wage compression. Folks want to be able to move into different kinds of work or different levels of management, and that space needs to be opened up a little bit more. Benefits for sure, full permanent work. Like this call, which is for 2.5 years, feels like a permanent job in our sector. Like, it's so contract based, and it's really, people can't afford that. It's really hard to recruit and retain people for like a 1-year contract or a 6-month contract. So those are some of the things that our members have said would really make a difference. And working conditions, like if you're supported around grief and loss and trauma, both like your own because you're not that much removed, or vicarious trauma. If you're not carrying a caseload, that is absolutely impossible. So you constantly feel like you're not doing a good enough job. That's just not sustainable.
Yeah, and the other thing I was going to say was, it's not always possible, I guess, in frontline, but flex time and flexible has always been another way in which nonprofits can compete rather than competing on compensation. But I think that's what we've noticed that's different in this moment. Those pieces are just not enough with the rising cost of living happening. And so really, ideally, in an ideal world, we shouldn't be competing on compensation, but we should be competing based on other meaningful factors like missions and mandates and work cultures and job satisfaction. Because if that was the case, then I'm sure, work cultures, job satisfaction, et cetera, could be higher in the sector as well. A couple of other questions have popped up. So let me know, Susan, which ones you want to take. So the first one is, rural areas have much higher costs as they are not able to find staff and need to bring in staff from outside the city and have to pay for their living expenses. It would be good to explore rural North challenges. For sure. So more of a comment, but yeah, no, that's definitely something we've been thinking about. And the other thing is rural geographies are a lot bigger and broader, right? Like Toronto might be concentrated or downtown might be concentrated in a small square footage, but rural spaces are so much larger. And that's where, if you're a worker who has to drive client to client to client and gas prices are $2, it's going to be quite difficult, right? So yeah, would love to explore more of that. And if there's any other examples out there with people listening in, please feel free to share them. Another comment.
And that cost of travel is analogous to, like, for staff who can afford to live in downtown Toronto, they could be traveling an hour, 2 hours to get to work, either driving themselves or on public transit. And that, the cost to time, the cost, the actual financial burden of doing that is really prohibitive.
Yeah. Another comment, there are opportunities to compete with for-profit, such as implementing a group savings for employees. This can be done by most major banks. So another way to sort of bring folks in. And then we have some questions. Really wonderful approach and discussion. Susan, one of our challenges is the fixed admin fee that we are chained to in funding proposals. Really appreciate the thought leadership around asking for what things really cost. Wondering if the Toronto Drop-In Network or ONN have ideas about how to get admin costs funded. Yeah, really great point. I think one of the things that, this is a critical piece of any funding reform work that if you can increase how much of the admin percentage of the budget is, you can get more really kind of like unrestricted core funding without calling it essentially that. And there are some funders that do this really well and some funders that don't. From ONN perspective, we worked on a transfer payment agreement operational policy with Treasury Board Secretariat a couple of years ago. Really trying to get, getting all the line ministries to align on how much admin fee folks can ask for. And although there was like a global, like if, I think it was 8% that that we landed on, it was just so hard to implement across the vast government machinery. And that's been the biggest barrier in that sort of funding space, is that even though you might have high level standards, minimum standards, or alignment, to get to operationalize that has been very difficult, because it's every ministry, every program officer, like it just differs. So that's where the challenge around that has been. But any comments? Yeah, Susan, on your end around that?
Yeah, we definitely, there's kind of a set amount of the 15%, but one thing that we discussed in our forums was often rent or space costs are considered admin expenses, and they should be program expenses. Because they are part of the like, especially for drop-ins, right? The space itself is part of delivering the program. So is to take that piece out of admin and put it into program expense. So clearly that's, that's, needs to be agreed by the funder in the end. But that was one of the things people had brought up.
Yeah. And just to Kathy's point also, we're trying to think of how admin and transfer payment agreement could be part of the red tape reduction, burden reduction agenda of the provincial government. So yeah, really thinking about that too. A couple of other, yeah, wage offers 20% for admin. We've been funded by wage, which has been really great. 20% is a healthy amount. Another question around, has any sector had any success in working with their ministry funder to work with them to reduce the wage gap issue? Surveys to understand full compensation, and then different funding models toward bringing wage parity down. I don't know of any concrete examples. I know there's definitely been conversations between ministries and like their subsectors. I know there's been a concerted effort around the like IRCC federally that funds some immigrant and settlement services. There's a lot of movement sort of happening there, and them wanting to work with the sector to come up with a model that works. There's going to be a funding guideline consultation for the childcare sector provincially this summer, or in the fall, which will touch on this as well. But I think really the only ones that have seen any sort of money come in has been the folks receiving pandemic pay. But wondering, Susan, if you had any thoughts on that.
Yeah, I mean, we only have about 7 of our members who receive LIN funding. I guess I can still call it LIN funding. So most are cobbling together money from the city, from United Way, for private fundraising. So that discussion about focusing on Ministry of Health and other provincial funding, we haven't had it yet.
Okay, yeah.
And Pam, sorry, we're at time.
Oh, we're at time. Okay. Definitely such a great conversation, and so much more to have to talk about and get out on the table. But I want to take this moment to thank Susan for coming in and chatting. Your labor and expertise around this is greatly appreciated, and I'm sure folks on the webinar also appreciated your insights today. For everyone else, thank you so much for attending. As we said, we want to continuously work on this and work on this collectively across the sector. And so we'll just share the link to join the Wage Parity Coalition list, so you can sign up, and we'll connect with folks who've signed up on that to continue the conversation, to do some coordinated advocacy work together. Please download the paper, share the paper, share some key messages. We'll also pass around because we're not in person, but we'll also share our toolkit, advocacy toolkit, how to use this paper as an advocacy tool, which has some really great messaging and calls to actions in there as well. So keep a watch out on our social media channels and our newsletter. But I hope everyone has a wonderful day. Thank you again, Susan, for joining us. And yeah, we'll continue the conversation.
Absolutely. Thank you so much.